Dr. Edith Fiore began practicing as a clinical psychologist in 1969, first in Miami, Florida, and later in the California Bay Area, in private practice in Saratoga. She stumbled upon hypnotherapy by accident in 1973 when she attended a weekend seminar at the Humanistic and Alternative Retreat Center, the Esalen Institute. Very quickly, she realized its potential in her practice, with Fiore writing in 1989 describing hypnotic age regression as an extremely effective therapeutic technique. Based on her years of experience, she wrote that a great majority of symptoms are due to repressed trauma. Hypnotic regression, therefore, could help patients to enter an altered state of consciousness, which, with the right guidance, could help unpick the root of trauma and thus result in immediate and lasting cures. One trauma which Dr. Fiore successfully used hypnotic regression to treat was alien abduction. Sensationally, after exploring her own contactee experience with Dr. James Harder, a professor of civil and hydraulic engineering at the University of California, Berkeley, who also pushed for disclosure in regards to UFOs and extraterrestrial visitation, Fiore realized that there were most likely others who had experienced being taken on board a craft piloted by non-human alien beings. Years later, a young patient, an 18-year-old called Mark, came to her practice seeking psychotherapeutic treatment for a series of distressing physical symptoms, including juvenile arthritis. Before too long, Dr. Fiore came to realize that there were striking similarities between Mark and others she had encountered, and indeed treated, who had experienced the horrifying effects of alien abduction. My name is Laura, and you are watching The Paranormal Scholar. Mark is a pseudonym. Indeed, as Dr. Fiore explains in her 1989 book Abductions, she did not usually work with people under the age of 21. 18-year-old Mark, however, was an exception. The grandson of two of her former patients, he had a challenging medical history, even at such a young age. At just 11 years old, Mark's dreams of becoming an athlete came to a painful end when an ankle injury resulted in an arthritis diagnosis. 3 months later, he was in the Stanford Children's Hospital. The disease spread to both of his hips and lower back. He was also diabetic. Speaking with Dr. Fiore in her consultation room, his frustrations were clear. As part of her standard practice, Dr. Fiore asked the young man if he had had any recurrent dreams. Mark recounted several, but one in particular stood out to the psychologist. Mark described being paralyzed. "I see a person for a split second," he explained to Dr. Fiore, as per the transcript provided in the book. "It's not even a person. He's like the dude on the cover of that book, the one with the picture of the UFO guy." Mark was referencing Communion, the 1987 book by self-described alien abductee Whitley Strieber. A bestseller that changed popular understanding of abduction phenomena, Communion is perhaps best known for its striking cover image, an artistic depiction of a being now commonly known as a grey alien. When Communion first appeared in bookstores, it caused a sensation, with many ordinary people who had no prior interest in extraterrestrial phenomena reporting feeling drawn to the non-human face on the cover. Like Mark, they found the image familiar, almost as though they had interacted with the being previously. And so when Mark explained his dream of the grey alien, which he had experienced many times over the years, Dr. Fiore was immediately intrigued. Regardless, Mark was seeking help with his arthritis, and so despite her interest in ufology and abduction phenomena, Dr. Fiore proceeded to move away from the conversation and started to regress her patient. After about 15 minutes, Mark, by now in a state of moderate trance, described seeing an image of a UFO to the psychologist. Unable to ignore the connection, Dr. Fiore describes her following her intuition and regressing the young man to the cause of his recurrent dream. "I'm 7, Mark murmured, hypnotized, and they're taking me up. They're levitating me up to the ship." When asked to describe the memory in more detail, Mark explained that he went through a transparent roof and into the ship. There were 2 aliens. Asked to describe them, he stated in trance that they had thin necks and arms that were much longer than human arms. Their form was kind of flat, with sharp cheeks, small mouths, and an egg-shaped head. Their eyes were concave and shaped like a cat's. As for their colour, Mark described them as almost black, but also green. Above all, they were big, dark eyes. At this point in his regression, Mark was frightened. "This feels like even the 2nd or 3rd time I've been abducted," he explained, still in a state of trance. At the young age of 7, he described being put on a little table that has wheels on it and being rolled down a hallway. In the room that the beings took Mark to was a 2nd little boy. Like Mark, he was lying on a table. Time passed, and the aliens took the boys from the tables. "We both have our own alien with us," Mark explained. "We're holding hands with it, and we're using it as a crutch, and we're walking." Entranced, he described being watched by the alien, almost as though it was studying his and the other little boys' movements. Then the aliens put the boys back on the examination tables. It was this point in the regression that Mark announced to the psychologist, "I kind of have a feeling that they're coming down here, wanting to mix with our race." When pushed to explain further by Dr. Fiore, Mark then went on to detail an invasive and intimate medical procedure to which the aliens subjected him. "They're getting a real small, real thin wire," he said. "At the end of this wire is a tube, and they've been squirting medicine in it. They stick that wire down my penis and squirt it into me." Horrifyingly, Mark described being out of it at this point in his childhood recollection, as though he had been anaesthetized. Unsettled and entranced, Mark expressed that he didn't want the being to hurt him. He recalled seeing some of the medicine from the tube leak out, and the alien moved to clean it. It was a pale blue color. As for the wire, it was long, almost like a fishing wire. When they were done inserting and feeling around, they are claimed to have pulled the wire out real fast. Mark also said that the beings told him that the procedure that he was being subjected to was meant to help us in the long run. When Dr. Fiore questioned the hypnotized young man to find out who he meant by us, he replied, "Their race, and not humanity." Further details from Mark's regression transcript reveal that the beings were able to control his consciousness at will. By putting a hand on his forehead and gently touching him, he would lose consciousness. At the end of the non-consensual medical procedure, Mark was woken by the being with a similar light touch to the temple, soon after which he awoke in his bed with a slight headache. On another occasion, the same alien beings, so Mark described during his regression, once again performed a medical procedure. This time, it seemed as though they were interested in his diabetes. "They have a big clamp around the left side of my side, my gut," Mark recalled in trance to Dr. Fiore. "It's sending pulses, shockwaves into my pancreas. I don't know what it's for, but it tickles sometimes, and every time it sends one of these waves through, my body twitches just a little bit." Mark was diagnosed with diabetes at the age of 7, around the same time that his alleged abductions began. At the age of 18, being hypnotically regressed in Dr. Fiore's consultation room, he was still diabetic and had not experienced a reduction in his symptoms. When asked by Dr. Fiore if the feeling of being examined by the alien being was familiar to him, Mark, still entranced, replied in the affirmative. "Yes, familiar, 'cause that alien was working on me is real friendly. He seemed like a pleasant person, like he's seen and talked to me before." Speaking again about his diabetes, Mark stated, "They knew what was wrong with me. They knew I had diabetes. Whatever they did to him, they did nothing to help or heal him. As for his arthritis, he explained, entranced, that he didn't think the extraterrestrial beings were helping with that either. They're just looking at it, his transcript read, studying it. They're not doing nothing for it. As for Mark's sperm, however, the beings were said to have been exceedingly interested in that. While regressed in Dr. Fiore's office, he described a second encounter that took place at the age of 15, after he reached sexual maturity. The memory was painful, with Mark once more describing the fishing wire type of thing being inserted in order to extract biological samples from his body. And not only was it painful, it seemed to have caused lasting damage. "I don't have kidney stones," Mark explained, "but when I go to the bathroom, sometimes it hurts." Despite recalling several traumatic abduction experiences, it was never made clear to Mark why he had been of interest to the large, dark-eyed beings. Once Dr. Fiore roused him out of the state of trance in which she had placed him, he expressed that his fear during the regression had been very real. "I could feel those scared feelings," he explained to the psychologist. "It had just been like it was happening right then." As for Dr. Fiore, she was struck by the similarity between Mark's described experiences and those of others who have alleged alien abduction. In particular, she was very interested in the being's apparent efforts to help his diabetes and perhaps his arthritis as well. For certainly, according to her book, in about one half of the cases she has been involved with, there have been healings due to operations and/or treatments. Even so, by her own admission, many of these individuals, those who recall seeming abduction experiences whilst undergoing regression, go on to develop phobias, anxiety, depression, amnesia, nightmares, and other emotional and mental disturbances. And so, what are we to make of Mark's regression transcripts and subsequent claims of alien abduction? Firstly, it is crucial to discuss the method used to obtain Mark's testimony: hypnotic age regression. After all, when examining contactee cases, its usage is controversial. Clinically, hypnosis is used as a tool for focusing attention, reducing peripheral distraction, and increasing responsiveness to guided recall. In Mark's case, the questioning of Dr. Fiore in the capacity of a mental health professional. In this way, hypnosis is associated with vivid and richly detailed reports, especially the uncovering of information or memories that a patient hadn't previously volunteered or remembered. A 2024 article published in the Frontiers in Psychology journal explored a 20-year perspective on the efficacy of hypnosis. Intriguingly, the comprehensive review concluded that there was substantial evidence supporting the use of clinical hypnosis to treat a range of mental and somatic health issues, with the vast majority, 99.2% of outcomes, demonstrating positive effects. Indeed, hypnosis reliably alters attention and subjective experience in ways that are measurable with brain imaging. That said, this study and others have also revealed important limitations when it comes to hypnosis, particularly in regards to establishing historical fact via methods including Dr. Fiore's age regression. Patients are at a higher risk of suggestibility and presenting false or confabulated memories, especially when the interviewer uses leading questions, confirms partial reports, or repeats suggestions. In this way, researchers have warned that regression may result in contaminated testimony, with court cases, as an example, repeatedly cautioning against treating hypnotically recovered memories as independent evidence. They are simply not reliable enough. And contamination and suggestibility are even greater issues when the patient or clinician are predisposed towards a certain viewpoint. In the case of Mark and Dr. Fiore, both had a pre-existing interest in ufology, with Mark, before he was regressed, admitting that he thinks about UFOs a lot. Indeed, whilst he was in Children's Hospital, he would, so he explained, hope they would come down and take me away. And so, when considered within the context of abduction literature, it is difficult to rely solely on hypnotic regression as the method through which elaborate abduction narratives come to light. It can certainly help to verify other evidence of abduction, such as physical phenomena, including anomalous marks on the skin. But on its own, the limitations of hypnotic age regression are difficult to overcome. And certainly in Dr. Fiore's book, she is quick to state that after the potential abduction memories surfaced during Mark's regression, she told the young man that they'll never know for sure the truth of the matter. Whatever the case, the session, according to Dr. Fiore, was helpful to Mark. He is said to have left her office satisfied and also excited to discover more about his experience with the aliens. As for Mark's eagerness to learn more about the extraterrestrials, and indeed his pre-regression fascination with UFO subject matter, an alternative argument may simply be that if he had, as the regression implied, genuinely been abducted by alien beings since the age of 7, it would only be natural for him to have an interest in them, regardless of how sinister aspects of his story seem. Arguably the most compelling aspect of Mark's regression testimony, however, is its similarity to other alleged alien abduction accounts. Aside from the obvious link to Whitley Strieber's communion grey alien via Mark's big, dark-eyed, egg-headed beings, we also see crossovers with other cases in regards to the sorts of things experienced aboard the alleged alien craft. Second Lieutenant Robert Salas, who was stationed at Montana's Malmstrom Air Force Base during its 1967 UFO missile shutdown incident, also described being abducted in California around the same time as Mark. It was 1985, and Salas, his wife, and 2 children were living in Manhattan Beach. The second lieutenant recalled lifting off his bed, floating towards the window, before somehow finding himself aboard a craft. There, much the same as young Mark, he claims to have been forcibly subjected to a painful medical procedure, the insertion of a very long needle-like instrument into his groin. The pain of the unwanted experience was described by Salas as extreme. Similar again in the Pascagoula incident of 1973, in which a female abductee, Maria Blair, who was at the river the same time as the more well-known Calvin Parker and Charles Hickson, described her reproductive system being interfered with by extraterrestrial beings for the purpose of DNA harvesting for alien-human hybridisation. As sensational as it may sound, it is far from unusual for alien abductees to allege, just as Mark did, that the extraterrestrial beings responsible for their abductions want to mix and thus interbreed with humanity. And so, when considered in that light, there is arguably much that is intriguing in Mark's testimony, with it quite possible that a little boy in the California Bay Area was abducted and medically experimented upon by beings very far away from home, indeed. Thank you so much for watching. I truly hope you enjoyed this video. If you did, please leave a like and subscribe for more of the paranormal. Interaction really helps our content reach more people and lets us know that you enjoy our work and want to see more. Thank you so much for being here. Stay kind and stay curious. Until next time.